Hello and good evening, and thank you for joining us this evening for the Chicago Institute of Advanced Surgery interactive webinar series. Some of you may be wondering where Dr. Lutfi is. He's in an emergency, but I'm his partner. Pleasure to meet you guys. I was planning to meet you next week, but we'll get an early start. My name is Francisco Quinteros, and I'll be introducing and moderating the session for you today. Today we have three presentations that are brief and hopefully very informative for you. The first one will be by Emma Wood, our registered dietitian. The second will be by Molly O'Brien, our PA in our practice. And the third will be by Dr. Lindsay Klingbeil, general and breast surgeon in our practice. We'll definitely have some time for questions in between the panelists, maybe one or two, but certainly afterwards we will answer any questions. We'll try to get to them via the chat, and also some that we think are more applicable and deserve to be discussed more in detail, we'll discuss at the end. So thank you very much, and we'll get started with Emma Wood.
Just need to share my screen here. Okay. So during last week's webinar, I really touched upon going grocery shopping and foods to pick out that are sustainable. And for this week, I really wanted to talk about meal planning and what to eat during quarantine. So for those of you who were able to tune into last week's webinar, I briefly touched upon boredom eating in quarantine, but I wanted to take this opportunity to elaborate a little bit further because it's the topic I've gotten the most questions and concerns about since lockdown. So the first step to combating boredom eating is to identify when you are eating out of boredom. And to do that, you will really need to be listening to your body and be mindful of your hunger and fullness cues. The word mindful is defined as a mental state achieved by focusing one's awareness on the present moment while calmly acknowledging and accepting one's feelings, thoughts, and bodily sensations, used as a therapeutic technique. So in summary, being able to acknowledge when you are hungry and when you are satisfied. Notice how I said satisfied and not overly stuffed. So a tip to really get in tune to your senses and be mindful in the moment is trying to identify each one of your five senses. So what are you hearing? What are you tasting, seeing, feeling? And that can really help bring you kind of into the present moment. Now, the biggest key to stop the cycle of boredom eating is to identify your why. And that's something that's going to be different for each one of us. Why you are eating out of because you're hungry, or you're bored, anxious, stressed, because you're watching TV. Is it a certain time of the day you find yourself snacking? So after you identify this why, this can then set forth motion to be aware of your surroundings and stop the boredom eating cycle. Some additional tips to stop boredom eating, really focusing on adhering to your normal meal schedule, but also focusing on incorporating the whole family during meal times, which can help increase mindfulness, but also decrease family stress. So to transition, I want to talk about forming meals and snacks to help you meet your goals and make sure you're providing your body with the proper vitamins, minerals, and nutrition it needs. Starting with the basics, which are protein, fruits and veggies, healthy fats, and complex carbohydrates. There are room for all of these food groups in a healthy diet, and having a proper balance of them will help you stay satisfied throughout the day and stay healthy. When planning meals, you should be focusing on foods that are nutrient dense. And when I say nutrient dense, these are foods that are high in vitamins and minerals and oftentimes lower in calories. Protein sources of proteins are considered nutrient dense. Protein helps build our muscles, skin, and cells. And when we are losing weight, protein intake helps make sure that we're maintaining our muscle mass, which in return is beneficial for our metabolism. Now, fruits and vegetables are also nutrient dense, and not only do they provide us with vitamins and minerals, but most of them are also considered high volume, meaning you can eat a large amount of them for very few calories. I recommend forming your meals around protein and produce, making sure you include at least one source of protein and one fruit or vegetable at each meal. Now, it's also important that you include healthy fats and complex carbohydrates into your meals as well. Healthy fats provide us with energy and they support our hormones. Healthy sources of fats, such as mono and polyunsaturated fats, can also help lower cholesterol levels and reduce inflammation. So some examples of these fats include avocados, salmon and fatty fish, nuts and seeds, and olive oils. Now, complex carbohydrates are our brain's main source of energy, and they also provide us with plenty of fiber. And so when I say complex carbohydrates, I mean things like quinoa, whole grain breads, rice, and brown rice, whole grain pasta, whole grain breads, and potatoes, as opposed to refined grains, which are white breads, white rices, and white pastas. Complex carbohydrates contain larger chains of sugar molecules than simple carbohydrates. So they actually take longer to digest and provide us with energy for longer. So you're gonna feel full for longer, which is why I'd recommend incorporating some complex carbohydrates into your daily meals. And making sure that you are incorporating each of these components into your daily intake to make sure that you're staying full and satisfied throughout the day. Now, I will say, as a dietitian, I commonly get asked about things like the ketogenic diet or stop eating all carbs or other various fad diets. And the majority of times, these diets don't work in the long run because they are too restrictive. When you restrict and deprive yourself of nutrients your body needs, you're more likely to have stronger cravings and overeat or binge these foods later on. This often arises in feelings of guilt, which lead to more restriction, continuing a vicious cycle. So to help you stay satisfied, incorporating all food groups and foods that you do enjoy in moderation into your diet can help break this cycle. Now, I did want to provide you guys with healthy snack ideas from when we are all stuck in the house and bored during this quarantine. And I won't go over these items one by one, but I'll be posting this presentation to our website, to our Facebook group, and I can also email it upon request. But I did want to mention a couple of things in that middle column, which is kitchen staples. These are items I almost always have on hand, and they can be really interchangeable and used in a variety of meals. So riced cauliflower is a great rice alternative, but also provides texture to salads and smoothies. Canned tuna, chicken, and salmon is a really convenient protein source. Frozen vegetables can be used in a wide variety of dishes. Greek yogurt-based dressings, Boathouse is a really good brand. They're very low in calories, low in sugar, and high in protein, just to add some flavor to your meals. And also low carbohydrate wraps. You can just make them like with every meal. So these things are really good staples that I'd recommend having on hand. And that is it. So thank you for listening. I've included my email so you can reach out to me with any questions, or if you did want me to send you those slides. And I also included my Instagram handle. I think social media is a really good way to stay connected and also get information. But when you're getting nutrition and medical advice, definitely being aware of who you're getting that information from, which is why I wanted to make sure I included that on the slide. And that is all I have.
Excellent. Thank you very much.
Very good.
Emma, we have one question here that I figured we'll sneak in now before we go a little bit later. But they're saying here, if someone's asking, is it true that breakfast is that important? Is it something that can be skipped? Is the old adage of breakfast being the most important meal of the day the most important? So I thought I'd let you comment on that, please.
Yeah, I get this question a lot, and especially regarding intermittent fasting. So intermittent fasting, for those of you who don't know, is not eating for a certain number of hours a day. And intermittent fasting works by decreasing overall caloric intake. So many studies have shown that eating breakfast helps people stay on track throughout the day and make smarter choices and are less likely to overeat in meals later on in the day. So it's really going to be on an individualized basis. If you aren't a breakfast person and you think that that doesn't impede or affect your eating later on in the day, then that's great. However, a lot of studies have shown that breakfast can be useful for people to stay on track. And I also will mention, I know a lot of patients who have had bariatric surgery are watching this. And if that is you, I recommend incorporating some type of protein during the morning, just to make sure that you can help meet your protein goals throughout the day.
Okay. So we'll answer some more questions I think that'll come in for you later on, but we'll move on to Molly O'Brien, PA, who will be talking about how you can stay active in the quarantine times without a gym membership. Thank you.
Absolutely. All right, let me just get this all situated here. Right. Oh, for some reason, hang on. Having a little difficulty with the PowerPoint for some reason.
If you'd like, Molly, we can go to Dr. Klingbeil and then come to you after she's done.
Yeah, that would be great. I appreciate that.
No problem. Okay, Dr. Klingbeil then, who's a general and breast surgeon, will be talking about obesity and women's health. And certainly in the quarantine, as you've heard from Emma, and you will hear from Molly, it's certainly a challenge to have appropriate activity and maintain a healthy diet for many reasons. So to sort of learn a little bit about sort of the adverse impacts that can have, we'll let Dr. Klingbeil educate us. Thank you.
Yes, thank you. I want to thank Dr. Lutfi for asking me to be a part of this webinar as well. I'm going to discuss the impact of obesity on women's health. And to start, I want to say it's a large topic to discuss. I'm just going to hit some high points, talk about obesity's effect on one's overall health, specific hormone changes and fertility for women, increased cancer risk that comes with obesity, and then putting this all together and recommending what you can do based on all this new information. I want to encourage men to continue to listen because this may also be informational for you, and I definitely think that you will likely know someone or love someone, a woman that can also benefit from this information, so please stay tuned. First off, we know that obesity gives you an increased risk of multiple medical problems. So type 2 diabetes, coronary artery and heart disease, high blood pressure, high cholesterol, osteoarthritis, especially in the lower back and knees, causing chronic pain and need for joint replacements, sleep apnea as well. Obesity is associated with multiple mental health issues such as depression and anxiety. Specifically for hormones, abdominal obesity is associated with increased insulin levels. And we know most of us insulin in the blood works to regulate our sugar levels, but it can also mimic a growth factor, a protein in the blood, causing increased production of male sex hormones, and we call these androgens. The insulin not only causes an increased amount of these male sex hormones being produced, but they also decrease the production of a protein that binds them. So you have both an increased amount of the hormones being made and more free hormones within the blood to act on receptors and cause problems. Fat cells convert these male hormones, the androgens, into estrogen. So obese individuals, male and female, usually have chronically elevated levels of estrogen in their blood. And why does this matter? Obese young girls, they have been shown to experience an earlier onset of puberty. And the menstrual cycle is regulated dependent on hormones. So looking at this graph, it shows the relationship of the hormone cycle with the endometrium, the inner lining of the uterus, growth during the cycle. And as the endometrium grows, the egg is released and it continues to grow. If there's no fertilization and pregnancy, then that endometrium sheds and women get menses. Up to 50% of obese women have irregular periods. And when you have this chronically elevated estrogen, you don't get release of the egg. The endometrium grows and grows and grows, which will cause problems later on when we talk about endometrial cancer possibly developing, but leads to irregular menses. And many obese women have to deal with polycystic ovarian syndrome, which is irregular or absent menses. And have increased acne, facial hair, body hair in areas that such as the back, and thinning hair on the head because of these chronically elevated male hormone levels. PCOS is a common cause of infertility, and 80% of women with PCOS are known to be overweight or obese. When it comes to family planning, hormonal contraceptives such as birth control pills and implants, birth control implants underneath the skin, they're shown to be less effective in obese women because of this chronically elevated estrogen. Giving a little bit extra estrogen to kind of fool this cycle and prevents ovulation doesn't work as well in obese women, increasing the risk for unplanned pregnancy. And pre-pregnancy obesity contributes to development of complications during pregnancy, which could include high blood pressure, preeclampsia, gestational diabetes, increasing the need for C-section, and neonatal death and certain types of birth defects. And switching gears a little bit, I'm going to talk about obesity and cancer risk. I took this picture from the National Cancer Institute, and it shows all of the cancers associated with being overweight and being obese. So multiple different cancers are associated with obesity throughout the entire body. Highlighting just a few, and we know that for women, the obese woman has an increased risk of endometrial cancer. This again goes back to the elevated levels of estrogen in the body, causing this endometrium in the uterus to grow and those cells to divide. And with cell division and growth, you can always have an increased risk of those cells changing and becoming a cancer. So obese women are 2 to 3 times more likely to develop an endometrial cancer, plus they're more likely to die from it. Postmenopausal bleeding is a hallmark of this disease and something that definitely needs to be evaluated by a physician. We also know that postmenopausal breast cancer is related to obesity. Again, most likely due to those higher estrogen levels, and the breasts are chronically exposed to those. For women with breast cancer, for obese women with breast cancer, it has been shown to decrease the survival rate, and you have a greater disease morbidity. So women with breast cancer can get surgery, chemotherapy, radiation, and hormone therapy, sometimes one, sometimes all of those things. Despite those, they can have a higher recurrence rate after treatment, increased risk of cancer in the other breast, wound complications after breast surgery, and something we call lymphedema, which is chronic swelling in the arms, usually after surgery. Morbidly obese women are significantly less likely to report having a recent mammogram. So not only do they have a decreased survival rate once diagnosed with breast cancer, they're often diagnosed later in stage because they don't have a recent mammogram. So putting this all together, what are my recommendations for all women? Getting your annual screening mammogram starting at age 40. If you have a family history, you may need to be screened earlier. As the breast surgeon in the group, I'm always happy to see patients in the office for a clinical breast exam, especially if you have a family history and a higher risk of breast cancer in your lifetime. I always recommend a website that is made by the Susan G. Komen Foundation called knowyourgirls.org. This is actually geared mostly towards the African American population because, especially in Chicago, African American women have a significantly higher death rate because of breast cancer. And this website is geared toward trying to decrease that difference between African American women and other women with breast cancer. But it's a fantastic resource for all women about mammograms, about breast cancer in general, about knowing your risk of breast cancer. So it's a catchy phrase as well. So Know Your Girls talks about self-exams, and I'm happy to see you in the office as well with any complaints, concerns, or just for clinical exams if you're higher risk. I recommend seeing your regular doctor or your gynecologist for your annual physical exam, pelvic exams. As there's an increased risk of colon cancer with obesity, get your first colonoscopy starting at age 45. Dr. Francisco Quinteros, who is moderating the session, is a colon and rectal surgeon and performs a lot of the screening exams. If you have a family history of colon cancer, you may need to be screened earlier. And Dr. Quinteros is happy to discuss that with you. Also, I recommend working closely with the Loop Feed Forward team, the bariatric team, Emma, Molly, the doctors to meet your weight loss goals and your health goals. And that's all I got.
Thank you. You know, here's one that a couple people asked was how is the COVID pandemic and the limitation of certain health services affecting the ability to get some of these screening tests that you're offering? I can answer that partially, but I'll let you answer that because I know this affects, you know, a lot of your patients as well.
Yeah, so right now, because of the COVID pandemic, screening mammograms are on hold at most institutions. That doesn't mean diagnostic mammograms are on hold. So if you notice a lump, if you notice nipple discharge or anything concerning, we can still get you in most places for diagnostic mammograms. Just the annual screening, that usually can wait a couple months. So once things cool down from the COVID pandemic and it's safer to come to the hospital, decrease your risk of COVID exposure, then we'll bring you back in for the annual screening mammograms.
Okay. Molly, are we able to work out the technical glitch?
Yes, we are. Perfect. Thank you
All right,
very much.
perfect. I love the internet. Let's do it. So we will catch up with you after you're done. Thank you.
All right, perfect. So I'm going to talk about here staying active without a gym membership. So let's go to the next slide there. So let's just start talking about metabolism here real quick. So metabolism. You may hear this word a good amount by both medical professionals or just your family or friends. The question is, what exactly is it though? It is the process of converting what you drink and eat into this energy. Now, why is this important? The energy that is metabolized is what propels the body to function. The body functions that require this energy vary. First, you have the functions that you don't necessarily think about, such as the ability to breathe, circulate blood, grow, repair cells inside your body, or just breaking down your food, etc. Now comes the more obvious functions that you think about with burning energy, whether that is certain activities that require you to get up and do something, or the different forms of exercise. All of these require energy though. So let's talk about which activities burn more energy. Next. So first thing we need to address is lifestyle. You may have heard people discuss a sedentary lifestyle. And so what's so bad about this sedentary lifestyle? Sedentary or prolonged periods of sitting directly impacts that metabolism that we discussed earlier. By sitting, you are not moving those muscles. By sitting, you are not forcing that oxygen to travel to the muscles and push that heart to really work. So yes, having an active lifestyle is much better than a sedentary lifestyle. It should be noted that although an active lifestyle is important, it does not burn the same amount of energy as exercise does. I have included a few examples of active lifestyle activities such as walking with family or pets, going outside to do certain chores, or parking far away from a store to get more steps. But even if you're honest with yourself, when you do any of those things, do you feel the same as you would if you went for a light jog or a fast-paced walk? Additionally, on this slide, I've added a few suggestions to just everyday activities that you may do that promote active lifestyles, such as taking the stairs or when you're brushing your teeth, adding a few squats in here or then. But again, this is just to promote active lifestyle. Next. All right, so in contrast, now we'll discuss aerobic exercise or exercise. So the first form of exercise we're talking about is aerobic exercise. Aerobic literally means oxygens. So what happens with this type of exercise? This is the exercise that causes an increase in breathing and thus increases that circulation of oxygen that can make it to the muscles, causing them to move and burn the energy. So what are the benefits to this exercise? Improved blood flow with making that heart work, building that cardio endurance, lessening fatigue, burning fat, and calming that nervous system too, which is always an added bonus. Aerobic exercise is also known as a steady state exercise because your heart rate is still staying elevated at that same rate for a consistent period of time. Doing that, you're burning calories, as well as increasing your cardiovascular endurance. There are different forms of this aerobic exercises that both include low impact and high impact exercises. So the most important thing is to elevate that heart rate. I'll discuss in the next few slides here examples of these exercises. The idea of elevating that heart rate is what differentiates exercises from an active lifestyle where you are walking gradually, having a conversation with someone next to you. The American Heart Association currently recommends a minimum of 30 minutes for 5 to 7 days a week. That can seem really daunting, so it is important to work up to that if you are not quite there yet, but don't get discouraged. Next. So the key with aerobic exercise, again, is to keep moving at an elevated rate. If you currently have no exercise routine besides casually walking or doing work around the house, this is where you should start. So let's start with walking. You do have the ability to make this into a workout, believe it or not. The difference is that you cannot hold a conversation again with that person next to you, and you will break a sweat if you do this intensely for 30 minutes straight, believe it or not. These walking workouts help set a pace where you shouldn't be able to speak. I've included a couple names of various videos that are free to everybody on YouTube over the web, and they're strictly walking exercise videos, believe it or not. The next aerobic exercise that I would like to touch on is dancing. It's the ultimate hidden workout. The key is really getting into it and not holding back though. There are so many videos on YouTube set to your favorite songs, but if you can't find your favorite songs, create your own playlist and dance it out. When you think about it, what is dancing but a series of movements and jumps coordinated to your favorite songs? The key is to not feel silly though, and to simply get a great workout instead. For those who are ready to do something a little bit more coordinated than dancing or walking, Zumba and cardio kickboxing are a great place to advance to. These both involve more coordination and incorporate more specific exercise movements. The best thing about all these aerobic exercises is that you can get everyone involved in it. Kids obviously love a good mix of music. Next. So for those with bad knees or bad backs, you may ask, where should I start? Doing something small, no matter what it is the most important thing. Of course, I would recommend starting with walking and increasing how much you are walking every single day. In addition, I would recommend to try some of these exercises that I have listed here. These are some basic exercises that really work on flexibility and stretching and can still elevate your heart rate if you do them for an extended period of time. I included here calf stretches, hamstring curls, knee rolls, straight leg raises, or up and downs. Again, the best thing you can do is getting these joints to move and getting them used to working out. And I just wanted to note here about back pain specifically because I know we got a couple questions about that last week. So unless your back pain is actually caused by a fracture or chronic disease, low intensity cardio and weight training can often help manage back pain. In fact, inactivity can in fact worsen the back pain. So core strength and stability are the key to help improve back pain as well. So target those core exercises to really strengthen that back. Next. So I know I'm a very competitive person, and sometimes the best competitor is yourself. So I've gone ahead and just added these couple challenges. There's a lot, if you look on the internet, 30-day workouts, 2-week workouts with all these different types of exercises, whether it's planks, sit-ups, push-ups, and you know, who's better to challenge yourself than yourself. So these are just examples of some of these challenges here. Next. And I just wanted to touch on this briefly. I don't know how many people have heard of HIIT or high intensity interval training. It can seem very intimidating if you have or have not. It may seem you need to have a class in order to do it. Perhaps you feel it is not where you are at with your level of activity, but I just wanted to give some brief information about it. Although the purpose of HIIT training is to do short spurts of high intensity moves to get your heart rate elevate and then quickly recover for the next round of high intensity exercises. You can do this with anything you can imagine, even doing this with jogging and walking, 30 seconds of jogging followed by 15 seconds of walking. This is a lot of times how people in fact work up to a 5K or a 10K if they have not ran for a long period of time. Next. All right, so here I have included a great chart for many body weight exercises targeting different muscle groups. This is a great chart if you want to try making your own HIIT workout as we discussed earlier, or if you're just looking for some great at-home body weights and you're tired of the same old push-ups and sit-ups. Now, if you are looking to add weights to your exercise but don't have a dumbbell set just laying around, I've listed a series of homemade weights that you can try, from textbooks to canned goods to bottled beverages to laundry detergent. There's so much available at home. Next. Now, lastly, I know we talked about getting the family involved with some of the exercises, with some of the aerobic exercises, but I did find this game for body weight exercises with the family that sounded like it could be fun and competitive. So you take a deck of cards and assign an exercise to each different suit. I've included a few exercises here, as you can see, and from there you go around the group, each drawing a card. The number that is on the card is how many of that exercise you are set to do. At the end of the deck of cards, the winner is the person that had to do the most exercises. All right, next. So please feel free to ask any questions about any of the information about specific exercises or anything that we've touched on. Thank you.
Thank you, Molly. A few people are asking for your email address, so we'll get it to them at the end, either in the question or I'm not sure if it's on our last slide. But certainly what you discussed, you know, it applies to everybody. I mean, we're all quarantining and having what everyone's discussed. I mean, I'm doing a fair bit of boredom eating, and I don't want to ask you guys and embarrass you. I'll admit to it, as well as the you know, exercise is just very hard to get. We're very sedentary, and so these are great, I think, tips, and you know, I think I learned something there. Now, one of the questions that we're getting here, I think probably based on that slide you showed, was, you know, are you really seeing, what did it say here? Are you really seeing people that have knee injuries or knee pain that's chronic? Are they really able to resume daily exercise with that?
Absolutely. You know, we see a lot of patients in the bariatric clinic specifically that come in, you know, they can't exercise because they have this knee pain simply. And so with the weight loss that comes after bariatric surgery, and the more and more they work themselves up to the point where they're getting exercise on top of losing weight, a lot of times the losing weight part is what alleviates a lot of this pain. Then we see a lot of people going and doing 5Ks, 10Ks even, you know, and so it's a normal thing to see with patients starting out with knee pain, back pain, and working themselves into a condition where they can do these.
Let me comment on this, Francisco. Sorry for being late. I was stuck in the OR, but great job. We're going to give you an honorary degree in bariatric surgery. You're double mastered in colorectal, triple general surgery, and now bariatrics. So thank you for your help. And I'm going to let you lead this. You're doing much better job than I would. But this particular topic is pretty much the most important thing I think to talk about today for those who are thinking of having weight loss surgery. We have to differentiate why we have knee pain. Am I having echo? Is my voice going okay?
I hear a small echo, but I'm not sure if it's what it's from. But I think we can understand you very well, though.
Okay, because I'm in a quiet room, but I thought, okay, just let me know, Francisco, to stop if it's not good. All right. So first we have to understand, why do we have a knee pain or back pain? Obviously, most of my patients come to see me maybe for their quality of life that is impaired by their back pain and knee pain because of their weight, or they come to see me for other reasons, and by the way, they have the severe pain. And what happens is there's a vicious cycle. The more pain you have, the less you exercise, the more you gain weight, then you'll exercise even less, and then becomes a vicious cycle. So once we rule out knee injury or herniated disc or something like this, that could be possibly from overweight, chronic obesity and overweight, then all we want, we're not going to ask someone who comes using a cane or a walker to go run a mile, clearly. But what we'll do is we'll work with you in things, you know, like water aerobic. You know, there's the YMCA, Chicago Park District. They provide these things. It could be covered by your insurance. And all we want, like Molly said very elegantly in some of her slides, just some movement to get that metabolic rate up. Exercise around the time of bariatric surgery is not necessarily for you to lose weight. Weight loss from bariatric surgery is multifactorial, and much of it is really from change in the metabolic pathways. And you pretty much lose weight the first 6 months to a year almost magically. I'm not supposed to say that, but this is the reality. because we interrupt many of the metabolic pathways that are related and cause obesity and insulin resistance. So all we want from our patient is do something to get that heart rate up, and once the metabolism, that's typically very low rate by the time people come and see me, once this goes up, when we do the surgery will be much more effective. So we want to cut that vicious cycle. I'm too big, I can barely exercise, so and my knee hurts a lot, so I'm not gonna move, and then my knee's gonna hurt even more, I'm gonna get bigger. The end of this is a wheelchair. So we will work with you with what Emma said and what Molly said about diet and exercise to break that vicious cycle and to get things going. And when bariatric surgery happen, for those of you who will have bariatric surgery, strengthening the core muscle, what Molly said towards the end of her presentation, will support these weak bones and weak cartilage. Because when you're doing a little bit of sit-up or activity in bed, those back muscles that are right here you go, that are right around your spine, right in the middle, they will get stronger and support your spine, and actually the pain will get less. It's just very, very important, because many of the patients don't come and see us and they think they're behind the 8 ball and there's nothing for them to do. I hear a lot, I have bone on bone in my knee, I need knee replacement. Plus, if you end up needing a knee replacement and there's no more cartilage, bariatric surgery is not going to cure you. The only difference it's going to make when you have the knee replacement, if you continue to have the same severe extra weight, that knee replacement will need to be revised in a few years. So what I would say is what we do is we work with our orthopedic surgeons and do an intervention right before and get people to lose 100 pounds. So they put the new knee, when they perform the knee replacement, then that knee will have a pretty much a higher chance to be very successful.
Well, I mean, as I understand it, that's become the standard for them, is to first pursue the weight loss for the optimal outcome for the orthopedic operation, correct?
Yeah, great, Dr. Quinteros. In fact, the NHS, the National Health System, which is the socialized medicine system in England, will not approve any knee replacement to any patient above body mass index of 40. So they will have to lose 80 pounds, so they all get bariatric surgery, and then they have knee replacement.
Yeah,
correct.
No, I mean, it like you said, it's multifactorial. Now, well, that actually leads to another question that we're getting here. I'm not sure who wants to tackle this. It's only a very simple question. Which is more important, diet or exercise?
Yeah, well, why don't we have Emma do that, and then Molly. Let's have Emma and Molly debate. They're like this, right? Boom. Emma.
Sorry, I was muted. So facts are facts. If you are eating too many calories, you will gain weight. So I think it's kind of a sweet combination of the two. But if you're eating above your caloric intake, like maintenance level, you're gonna gain weight, even if because you might not be burning that off through exercise. So it's really kind of a sweet spot. And I think a lot of times with bariatric patients at that plateau, exercise is going to be essential to keep that body burning. So, I mean, I guess that's kind of a lame answer, but I would say a sweet spot, but.
Yeah,
I think but we'll allow it. Molly, do you have a stronger retort?
I actually, I actually have to side with the diet being the most important thing, because I think in order to have a great exercise routine, I think you need to be fully fueled correctly, and you have to be eating the right foods. You can't be eating, the fatty foods, and because when you eat those fatty foods, then you're not going to be able to run, work out. It's all about what you're putting into your body in order to provide that fuel to exercise in the long term, in my opinion.
Let me just give some numbers. In one donut, there's 195 calories. I just state the facts and let the audience, we can do polls as well. I just realized we can do poll here, so maybe next week. But in one donut, there's 195 calories. If you walk a mile, an entire mile, you burn 100 calories. So by eating one donut, to burn that donut, you have to walk 2 miles. So what I tell my patients, you can never exercise enough to burn what you eat. So this is why I would side with Emma's argument about diet. It is incredibly rich in calories. And what's nice about bariatric surgery is there's no trick. It's not like Jenny Gregg, Weight Watcher. There's no tricks. We're just gonna decrease the amount of what you eat and get rid of that intense hunger signal when you eat. So because what we eat is mostly what causes obesity.
Now, you know, I know that we focused on women's health, particularly with Dr. Klingbeil's topic, but you know, a lot of those things, although certainly estrogen-related cancers are, you know, seen more in female patients, certainly this is a widespread, you know, this concerns everybody. And there are many tumors that it's not quite a smoking gun, like you would say for lung cancer and smoking, and like what we're seeing more with endometrial cancer, you know, gynecological cancers and high estrogen. But certainly, there's no doubt that there is a link between a myriad, you know, just so many different cancers and premalignant conditions and being overweight. And we also know that it's not just you're overweight or you're not overweight thing. It's a spectrum. So the more overweight you are, the more risk that you have. So, I mean, like I said, I know some of the guys may have tuned out during that portion of it, but you know, there's certainly a lot of relevance there for us as well, aside from other benefits. But I just wanted to point that out because I wanted to make sure that people understood that there's so many more things. Those are the strong ones, which he discussed, but there's many others that are proven not at quite a high level, but that most experts don't have very much doubt about that.
Dr. Quinteros, I see a question here that's asking about screening colonoscopy, if you are put to sleep or not, and how important and is it dangerous to have screening colonoscopy?
Oh, no, it's a very, very, very safe procedure if you've never had one. It sounds scarier than it is, and almost everyone complains more about having to take a bowel cleanser. It's a laxative, essentially, to clean out the intestine so we can see. But the procedure is done with anesthesiologists giving a very gentle sedation, but it's done by anesthesiologists, and that's the critical part. So they're able to put you to sleep, wake you up, and most people don't report what they used to call as like a hangover from older medications. They wake up and do it very well. It takes about 25 minutes. So it's extremely safe, and that's why it remains the gold standard. There's other tests that are very good and complement it, but there's still nothing quite as good as a colonoscopy, and certainly safe to get. And as Dr. Klingbeil mentioned, right now, screening ones where it's your time, our age was 50, it's been moving towards 45 for the last few years. You may have read in the news, I don't want to talk too long, but about, you know, finding colon cancers in younger people. So we're not sure why that is exactly. Obesity is actually suspected to be one of the risk factors, but it's right now, no. Of course, as our ORs are starting to open up in the next few weeks, which we've been getting word that that's what's happening, and we've been part of the committee calls to reopen them, then you know, we'll be going back to that. But in the meantime, yes, right now it's not the time for that. But in the next few weeks, this will be resuming pretty normal, I think, hopefully, activity to provide healthcare for people.
Dr. Klingbeil, one question that is not written here, but many of my patients ask me in clinic, when you're morbidly obese, depending on your genetic and race, you have a large breast, and depending on the fat distribution, but in general, the breasts become larger, and in some women, they're very large, and they're very concerned about breast exam. In addition, there are patients who may not have very large breasts, but they do have a more fibrotic breast or nodular breast. Can you, what is your advice? And I know you said it in your slides, but I want to kind of emphasize it. It just comes up so many times in my clinic. What is your true advice to women with very large breasts who are morbidly obese?
Again, know your girls. Do an exam. There's no recommendations as to how often, but they recommend just knowing what your baseline is, knowing what your normal is, so you can recognize something that's abnormal. With women with larger breasts, I think that's harder because there's more tissue to know, and they may not remember, was this here last month, or I can't remember where this was. So that's where screening is very important. And the imaging, screening mammograms, ultrasounds have always been shown to be superior to then clinical exams. So knowing your girls, knowing what your normal is, so you can recognize abnormal, and getting your screening mammograms are very important.
It is fair if I were a morbidly obese woman with large breasts and I'm scared and confused because every time I push, there are all these nodules. It is fair to make an appointment just for breast exam and advice, or should I call if I have a good insurance and get a mammogram? What do you recommend coming to someone like you?
Yes, because some women just can have dense, what we call lumpy, bumpy breasts, and they feel something that they may not have noticed before. And like I said, some fibrocystic breasts can be dense, and more lumpy, bumpy, you can form cysts more often. And sometimes it's better for peace of mind to come and see your doctor, get an exam. We'll correlate it with the imaging findings. If maybe you don't need screening exams, maybe you need an ultrasound, maybe you need an MRI if you have a high family history risk. So we can examine you, we can talk about your concerns, we can also see you frequently to see if things change, and if things get bigger, get smaller, and follow you over time.
Emma, here's one that's been asked twice, so I guess it's important. People complain about feeling nauseated after taking their vitamins after bariatric procedures, and they say they've tried, kind of like taking them at different times and stuff. But is there? I was wondering if you could answer that for this patient.
So it's really common in anybody actually taking any supplement with iron. It's very common to feel nauseous after it. So my recommendation for any multivitamin or any supplement that contains iron is to take that at your evening meal with food. That will help decrease the nausea, and you'll be sleeping for part of that time during digestion, so that will help as well.
Okay. I think at this point we've got a few more questions. Eric, if you're there, are there any that you're seeing that are we should prioritize? Because I'm not sure how much time we have left.
Dr. Quinteros, let me just say a couple of things. We will need to put maybe a slide with our emails. If Eric can put together a quick slide with our emails.
Well, I think we'll go ahead and try to send that in the follow-up email. I think, how does that sound as a good solution? Everybody who has joined us today will get a follow-up email in about a day or so, and that will have instructions on how to access all of our webinars throughout this series that are all going to be contained in one easy to access place. We'll also have any kind of contact information you need to get in touch with us, and information about our next webinar, which will be more focused on general surgery problems applicable to everyone, and exactly what do we do about those problems during this time of quarantine and COVID. When is it okay to watch something, and when do you really need to come into the hospital? Because I know none of us are at the moment jumping to come to the emergency room, but sometimes something does require us to do that. Now, I do see a question that I'd like to answer, a great question, mentioning hiatal hernia repairs.
Eric, your voice is, I'm getting a lot of complaints that people cannot hear your voice. And it looks like my voice as well.
Yes, I think we are becoming a little staticky here.
Dr. Quinteros, can you take over and just talk a little bit about the reopening, and then we will conclude? We don't want to give people headache, and maybe we'll mention hiatal hernia next week with Dr. Veilleur. But let's talk a little bit about the reopening, and we'll conclude.
Yes, if everyone could please mute their microphone for right now, just to make sure. So the reopening, I'm sorry I don't have the slides available to share, but essentially, as Dr. Lutfi has mentioned, he's part of various committees at hospital, and I've also been a part in other institutions that we go to about the reopening, which is happening tentatively. It looks like the earliest might be the week of May 11th, and sort of ramping up, of course, subject to how the state of Illinois is doing with that, because there are multiple requirements from the Illinois Department of Health that will allow us to go. But so far, various hospitals are meeting that criteria. And essentially, one of the things that I think that you as a patient would like to know is essentially the surgery that you may be having, or any procedure that you're having, the clearance and the preoperative workup is the same, because the surgery is the same. But the one addition, of course, is all the precautions that we will be taking. The one that will directly impact you that you'll notice is that you will have to come for testing, depending on the institution, between 48 and 72 hours prior to the procedure. And institutions are, you may do it outside, but they're usually asking you to come in and do it. And it is a swab test. So it is the one where the swab goes very high up in the nose. It's uncomfortable. But it's very quick, and you get the test back later that day. You're expected after that procedure to go home and quarantine at home for the safety of yourself, your fellow patients, as well as your own family that you may bring anything home to, and the staff and surgeons that are working on you. The surgeons and the staff and everyone in the operating room and the anesthesiologist, everyone that will be in any contact with any patients is also swabbed. So that you know it's not just a one-way street, it's not just the patient, but also we are being examined and swabbed to make sure that we're not having any difficulties or any signs of coronavirus that we could transmit. So that's sort of the process. So it's a standard everything else, except that with additional testing, and of course everyone will be wearing the appropriate protection gear. And the thing I always want to emphasize to people, this is both ways. You know, it's not because we're worried about you, it's so that you don't catch anything that we may have. And so all personnel are going to be wearing the appropriate equipment throughout the preoperative, operative, and then post-op period on your way home. Thankfully, specifically for, you're going to start with surgeries that are outpatient or that have a short stay. So bariatric surgery, thankfully, it's evolved to the level that I don't know the number. I truly believe it is 99%. You know, people say 99%, but this, I think, actually factually, 99% of our patients do go home the very next day. They have their own section in the hospital. And so there's no, you know, our job is to get you in and out safely when you're ready, which is almost always the very next day.
I think once Eric left, everything got better. Oh, that's terrible.
Yeah. Well, you know, we can talk about hiatal hernia, and as Eric was mentioning, I know it was difficult to hear him. Next month, we'll be covering a few topics that are kind of more routine and things that, you know, it's not, well, it's never anyone's fault when they get sick, but it's certainly not your fault that you would have the bad luck to have some sort of illness during the pandemic. And so we still have to treat your illness, you know, the same. Just because you happen to have abdominal pain doesn't mean that you're, you know, you're not someone that we need to see or evaluate. And so the webinar next week, we're going to plan on talking about sort of common conditions, when to go and when to stay. You know, abdominal sort of things that we run into as general surgeons and specialty surgeons very, very often, planning to focus on and also this has a lot of cross-link with our bariatric patient population, is gallstone disease, you know, gallbladder disease. And we'll certainly outline that for you and describe that. One near and dear to my heart is hemorrhoid disease. You know, anything related down there, no one wants to talk about it. It's awkward, so people are embarrassed. But hey, I know from my patients and that no, you know, if things are not well down there, you're not well. And it can be scary too. And then of course, other things like hernias, when people say, I've had a hernia for a long time and it's, you know, it's there, but when do I go? You know, so I think that'll be a kind of a good one because it just fits so many people. So we'll plan to talk about that next week.
Great. And we'll introduce our fourth partner, Dr. Giovanetti. You can see his picture with a big smile. You know, I'm sure he's smiling behind the screen now. So very proud of our group and very happy that we're seeing patients on Zoom. Today we saw about 30, 40 patients on Zoom between the various specialties. Thank you everyone for tuning in. Thank you, Dr. Quinteros, for filling in with me. I'm glad I could join. Thank
Well,
you,
I'm glad
Dr.
that,
Limby.
I'm assuming the patient's good because you're smiling. So
Here we go. Always. Thank you, Dr. Klimbiel. Always so good to hear you speaking. Thank you, Emma. And looking forward to learn from you myself after this quarantine. And thank you, Molly. I need to hire you to come here and train me every week. We appreciate everyone's time and thank you. Have a good night. We'll see you next week.